Parliamentary updates.
Chaguanas was the next stop for the third in a series of town hall meetings put on by the Joint Select Committee on Social Services and Public Administration. The meetings are aimed at gathering comments from members of the public for the committee's inquiry into Trinidad and Tobago's response to the prevalence of non-communicable diseases with specific focus on diabetes, cardiological diseases, and cancer. Chairman of the committee, Senator Dr. Paul Richards, told the audience why town hall meetings.
This town hall meeting is being held to provide the public, citizens, you, the taxpayers, with a platform to directly engage members of Parliament, your representatives, on some of the critical issues concerning the delivery of public healthcare services in the country. This is an opportunity for you to share your experiences having interacted with the public healthcare system at one time or another, or in the company of a family member or relative. We'd also like you to make recommendations for improving the public healthcare system based on your experiences.
Senator Richards made clear the remit of the Committee of Social Services and Public Administration.
The committee is not empowered to provide redress or remedies to individual complaints. So I know some of you may have ailments or issues. We're not here to diagnose or provide advice on those, right? We do have the power, however, to hold the Ministry of Health and those who manage public hospitals, RHAs, accountable for their performance, their policies and their procedures, their programs and initiatives in their interface with you. We are one of 14 committees of Parliament appointed to scrutinize or oversee certain aspects of work of the government of Trinidad and Tobago. The committee's work is not dictated by any political party or any political agenda.
Speaking on health matters was Dr. Abdul Hamid, primary care physician 2 at the North Central Regional Health Authority.
Now, these are the risk factors that we have to focus on as a population. And these are things that are what you call small ticket items, basically things that people can take on their personal volition to change. These are tobacco use, alcohol abuse, unhealthy diets, obesity, and physical inactivity. Moving on, we have high blood pressure, high cholesterol, and raised blood glucose.
Dr. Hamid zeroed in on one particularly critical statistic that should be addressed urgently.
Overweight and obesity. This is something we should not be proud of. 55.7% of the population 15 to 64 years old are overweight or obese. And that's another scary statistic. But as I said, we can change this.
Members of the public were then invited to give their experiences regarding the management of the healthcare system.
My view, I have visited a couple on my own. They have been, in many cases, underutilized. And I want you to take a note of that, because you have health centers finish at 4 o'clock. And you have the community still alive and active, the villages. And many instances, you have to go to Cuba, let's talk about Central, or you may have to go to Montrose. Now, Montrose have been moved to Ramsaran Street. But there are buildings could be maximized and utilized to its fullest 24 hours.
I went with my backpack because when I went on Monday, I went through I got a pain on Monday, went through Chaguanas clinic, was transferred by ambulance to Mount Hope, sat down in Mount Hope, and they wanted me to stay. They wanted me to spend the night just so that I could get to see the senior cardiologist the next day, the next morning. So they wanted me to spend the night to see the senior cardiologist. I had not had anything to eat or drink because my family cannot come into emergency. I was in the same thing from 8 o'clock until 7 o'clock in the night.
But my take is the youth. And I'm saying that because our schools, our school system, our primary school, our secondary school, even our daycare systems, where our children go, where no one goes and look to see what they are eating. I'm saying it today because I said it for years. As the former advisor to Minister Garcia on the TVET, I'm saying it again today, that our school cafeterias, our school canteens is not being looked at. I've called for a meeting with the Minister of Education of October of last year, and we just keep getting letters that we will and we will and we will. And I'm saying it today that we cannot be using a document of 1984 to run our school cafeterias. It's there. It's produced by the Ministry of Education and it's out there. This is what our cafeterias are using. And I'm speaking because I visit over 400 schools here in Trinidad and Tobago.
We also spoke with members of the audience.
Now, I listened attentively to each of the speakers and their plights that they would face in the regional health authorities. And I think that their feedbacks should be taken, it should be taken with the greatest of efforts from the, let's say, the ministry or from those in authority to be fixed so that these persons don't continue to go through these problems.
I work in health for over 30 years, and I'm glad that we have this joint select committee that we could come out and speak on the health issue, and I really will want for something to be happening into the health system with the waiting and the pharmacy and medication, and that waiting time that making for the clinics, where people go to the clinics, they have to sit down there and wait. It's really unfair for the person to be there.
Well, I'm hoping to see the improvement with the delay in the health system, because the appointment is very too long, right? And of course I nearly lose my eyesight for that because I had to get it private, and I get it private to save my eyesight. And even the diabetic clinic also, when they sit up, they don't have all the medication all the time. Sometimes when you have to miss a month, it's falling back now with your health, so I have to buy it on the outside to keep my health going. And these are the things I believe they should look at these things.
Stay tuned for further parliamentary updates. For more information, visit our website at www.ttparliament.org and follow us on Facebook, YouTube, Twitter, and Instagram.
Parliamentary updates.